You know, treating diabetes isn't just guesswork. It's actually a carefully crafted strategy. In this explainer, we're going to crack open the official playbook that doctors use, decoding the very latest guidelines from the American Diabetes Association. We'll find out exactly how they make those crucial treatment decisions. So it really all boils down to this one big question. I mean, managing blood sugar isn't a one-size-fits-all kind of deal. It's a really complex challenge that needs a plan tailored to the individual, and that plan comes straight from a super detailed, evidence-based guide. And this is where it all comes from, the ADA's Standards of Care. You can think of it as the master document for all things diabetes treatment. Its whole purpose is to lay out everything, the goals, the guidelines, and even the tools to make sure the care is actually working. It's the foundation for everything we're about to get into.
All right, first up, let's dive into type 1 diabetes. With this one, the core problem pretty much dictates the solution, and that solution is all about replacing something the body just can't make on its own anymore. See, in type 1 diabetes, the body's beta cells, its own little insulin factories, well, they've pretty much closed up shop. This means insulin isn't just helpful, it is absolutely essential for survival. The entire treatment strategy is built around replacing it as effectively as possible. So how do you get that insulin? Well, there are two main ways. On one side, you've got multiple daily injections, or MDI. That's the more traditional route with pens or syringes. And on the other, you've got the insulin pump, which offers incredible flexibility, but yeah, it comes with a higher price tag and you have to wear a device. It's a classic trade-off between simplicity and high-tech precision. But hold on, the story doesn't just stop with pumps and pens. Technology has been a total game changer here, moving us away from constant manual adjustments to intelligent, automated systems that are quite literally changing lives.
And that brings us to these things called automated insulin delivery, or AI systems. They basically link a glucose monitor directly to an insulin pump, creating a hybrid closed loop. So the system is constantly watching glucose levels and automatically tweaking insulin delivery behind the scenes. And the result? More time spent in that target blood sugar range and a huge drop in the risk of dangerous lows, also known as hypoglycemia. Okay, let's switch gears and talk about type 2 diabetes. While type 1 is all about replacing insulin, managing type 2 is, well, it's a whole different ballgame. The new rules really stress a highly personalized approach that goes way beyond just bringing down blood sugar numbers.
So, imagine someone just got diagnosed. What's the very first play the doctor calls? Well, the guidelines lay out a very clear and common starting point for most people. And here's the classic answer. For most people, treatment kicks off with metformin, a safe, effective, and pretty inexpensive medication teamed up with big-picture lifestyle changes. For decades, this has been the standard first-line defense. But that standard is definitely starting to shift for a lot of folks. And this right here is the question that has totally rewritten the playbook. The ADA now says that if you have or are at high risk for cardiovascular or kidney disease, the initial game plan has to be different right from day one. This is honestly one of the biggest shifts we've seen in diabetes care. The focus has changed. It's not just about the A1C anymore, which is that measure of average blood sugar. If your heart or kidneys are at risk, the guidelines now say to start these powerful protective medications like GLP-1s or SGLT2 inhibitors right away, even if your A1C isn't all that high. The number one goal becomes protecting those vital organs.
Now, when an injectable medication is needed, this comparison is absolutely crucial. The ADA guidelines now have a clear preference for GLP-1 receptor agonists over insulin whenever possible. So why the big change? Just look at this. GLP-1s have a much lower risk of causing low blood sugar, and they often lead to weight loss, while insulin can sometimes cause weight gain. It's a strategic choice based on overall health benefits, not just those glucose numbers.
So as we start to bring this all together, the big takeaway is that modern diabetes care is becoming incredibly personalized. It's not just about what pill or injection you're taking, but also about the practical skills and the real-world challenges that come right along with it.
And this right here is a perfect example of what I mean by that practical side. The best medicine in the world isn't going to work if it's not delivered correctly. The guidelines really emphasize mastering how you do injections. You got to rotate those sites. That's critical to stop fatty tissue from building up, which can totally mess with how your body absorbs the insulin. And using shorter needles, that helps make sure the insulin goes into the fat layer, not the muscle, which could cause really unpredictable and dangerous drops in blood sugar.
And you know, the ADA is really clear about this.
A treatment plan is only as good as your ability to actually follow it. This means things like cost and access aren't just an afterthought, they're a central part of the conversation. The choice has to be a joint decision, one that's not just effective, but also affordable and something you can stick with.
And to really hammer that point home, look at this number. That's the median monthly cost for just one of those newer, highly effective SGLT2 inhibitors. This single number shows you exactly why talking about cost isn't an extra step. It's a core part of building a diabetes playbook that actually works in the real world.
So at the end of the day, that old idea of a one-size-fits-all playbook, it's gone. It's history. It's being replaced by a personalized strategy guide that takes into account your unique biology, your risks, your lifestyle, and your resources. The future of diabetes care is really all about finding the right set of plays just for you.